Hey everyone, as you probably know, your gut has far-reaching impacts on your health, not only impacting gut symptoms, but also your skin, your brain, your joints. And colitis is one type of gut problem that occurs in about 1% of the population. It is an inflammatory and autoimmune process that does damage this very important absorptive lining of your intestinal tract. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health, exploring the importance of nutrition, lifestyle, and gut health through conversations with experts, research reviews, and personal stories. We break through the bias and the noise to bring you simple, trustworthy information that matters. Let's discuss what causes colitis, how to know if you have colitis, and then if you do have colitis, what you can do to support that inflammation, that autoimmunity, and reduce your symptoms. Colitis, aka ulcerative colitis, is the most common type of what's known as inflammatory bowel disease. This is where there's inflammation, autoimmunity, and this can eventually form damage or even ulcers to that mucous membrane of your intestinal tract. And how this tends to form is firstly in the rectum, and this would be known technically as proctitis, and then in a continual fashion can migrate or progress to also include the left side of the colon, and then eventually, if it gets quite severe, can impact the entire colon. This is similar but different from another type of inflammatory bowel disease known as Crohn's. And in Crohn's, this can affect both the large intestine or the colon and the small intestine. But let's go a step further and try to better understand what is happening in colitis. I mentioned a moment ago that there's this overactivation of the immune system leading to inflammation and autoimmunity. And if you've been following my work for a while, you probably understand that there's this sort of lead up that then allows this condition to happen. And what you're seeing in this diagram helps us to better understand this. In a healthy intestinal tract, you'll have an appropriate balance of the microbiota or the bacteria. You'll have a healthy mucous membrane, and you'll have a healthy epithelium or gut lining. But with a number of factors that we'll detail in a moment, stress, poor diet, antibiotic use, emulsifiers in your food, you can start to wear down this mucous membrane, skew the balance of the bacteria, and damage this epithelium or this membrane. And this is where we have leaky gut and dysbiosis. And this can be one of the initiating factors, or these can be one of the initiating factors leading to damage of the gut lining, and then eventually leading to this excessive immune response, this autoimmunity, and this inflammation. And credit to the journal Frontiers in Nutrition for this diagram that helps you see part of what's happening that may later be diagnosed by a gastroenterologist when he does a colonoscopy and sees this. Now, for those of you who are only listening, I'll do my best to narrate these various photos of the colon showing progression from a normal colon and a normal lining to that where we see severe colitis. And it's quite apparent, even to the untrained eye, that this smooth sort of pink tube that is your colon becomes patchy and inflamed. And this is really where a lot of the symptoms come from. This inflammation that is immune mediated and can lead to the next question that we should answer, which is, what are the symptoms? And most noteworthy is bloody diarrhea. There isn't always bloody diarrhea, but that is a hallmark of ulcerative colitis or colitis. This is different than having bright red blood on your stool, or on your toilet paper rather. That can be an indication of hemorrhoids. So it is important to differentiate these, and this is where just following up and having a discussion with a healthcare provider should be very insightful. But bloody diarrhea is the hallmark. Now, along with this, it's probably not surprising to see a number of other related symptoms: abdominal pain, cramping, bloating, frequent bowels, stool urgency, and mucus in the stool. The other thing here that we should tie in is because the gut is so important for many functions in the body, including inflammation, it can influence other systems and cause other symptoms. And this is where we see, and we should include, fever, fatigue, and this fatigue can be due to anemia. So as you can probably imagine, if there is fairly extensive damage with the bleeding can cause anemia, and potentially if there's malabsorption, that can also contribute to the anemia. And with that, there can be weight loss and a loss of appetite. Now, there's also some of these sort of far-reaching effects that the gut can connect to, as we've discussed on the podcast before, like joint pain, eye problems. There's a number of these, but there could be uveitis or conjunctivitis, so inflammation in the eye. There could be blurred vision. There could be dry eye. There could be eye pain. Various skin issues like eczema, psoriasis, atopic dermatitis are all correlated. Osteoporosis, probably not surprising. If there is malabsorption, then that could cause a malabsorption of calcium. And also gallstones and kidney stones, in part because of throwing off some of the motility in the GI tract, which at least in part can impact the gallbladder and potentially to the formation of gallstones. So this is your list of symptoms. Remember that the hallmarks are really frequent stools, and also especially if the stools are bloody. Hey everyone, by the way, if this video has been helpful, please comment, like, and subscribe. Especially the comments are very helpful for me to hear what you find noteworthy and what questions that you have. And also like and subscribe so you see future videos from us. Now, I want to make sure to, and we'll detail this more in just a moment, but make sure that you're aware that the prevalence of colitis is about 1% of the population. There's a very similar symptom overlap with IBS, irritable bowel syndrome, which affects 15% plus. The other thing that I wanted to flag for you is that it's much more common if you have a family member with colitis. So a first-degree relative with ulcerative colitis, your risk is increased by about 4%. So this can be part of a larger exercise wherein if you're having these symptoms and you're not sure, are they IBS? Are they potentially colitis? Look to your family tree. If you have first-degree relatives with colitis, then that throws up a flag of suspicion. If you don't, but rather you have close relatives with IBS, then it's more likely that you could have IBS as the cause. And this is where a healthcare provider can help you sort some of this out. Now, thankfully, the natural therapeutics tend to work whether it be IBS or IBD. I wouldn't say this exempts you from having a medical follow-up because you do want to get some clarity on the diagnostics. All that being said, if we can take care of ourselves with diet, nutrition, lifestyle, and things like probiotics and herbs, then we may not ever get to a point where the symptoms are bad enough where we have to go to a conventional medical provider to have the screening and the diagnosis. Okay, so I want to backpedal just for one moment to some of the risk factors. And in this diagram, what you're seeing, and this is a credit to the Mayo Clinic, is a prevalence map of colitis worldwide. And the darker the color on the map, the higher the prevalence. And you see a loose trend that westernized countries have a higher prevalence. One thing here I wanted to point out for you, if you draw a line laterally in the middle of this diagram, you would have a region of the world that presumably has the highest vitamin D because there's the highest level of sunshine. And what you see is there's not an inverse relationship between equatorial regions and lower incidences of colitis. So the vitamin D hypothesis, as it's known, posits that those in northern or southern latitudes, right? So north or south of the equator are going to have less sun, therefore less vitamin D. Therefore, you might have higher risk for autoimmune conditions. But if you look at Southern America and other areas in Eastern Europe, you see that it doesn't really hold. So there's probably more to it here than vitamin D, although getting time in the sun should be protective. But I just wanted to flag that there doesn't seem to be a super tight correlation between if you live in a equatorial high sun region and therefore have more vitamin D, a lower prevalence of colitis. But Western living is one causative factor, or at least one risk factor. And there's a number of things, of course, that accompany this. Another one that we should acknowledge is the hygiene hypothesis. And this is what I think probably has more merit. If you live in a Western society, one of the downsides of the higher hygiene is that you have less exposure to dirt and to germs that help to train the immune system. There's a pro-con here, and in Western societies, we may have gone too far in the direction of hygiene because we do see a pretty tight correlation between Western societies and inflammatory and autoimmune conditions. Now, again, the challenge is these things are multifactorial, so we can't put all of the culpability on one of these agents. But nevertheless, trying to have exposure to naturally occurring dirt can be one disposing or predisposing factor that you may want to be aware of. The other more obvious sort of elephant in the room is the diet. And there's a number of things in the diet that can be problematic in increasing one's risk for colitis. Processed foods, which contain emulsifiers, amongst other things, the emulsifiers can irritate and break down this mucous membrane and start this process of leaky gut. Of course, with refined carbohydrates, they will have less fiber in them, and that can also be a risk factor. And the consumption of meat, the consumption of fat, what that correlation looks like, I think is hard. Even the consumption of healthy carbohydrate, I don't think we can make a case that any of those are the problem. It's probably mostly the processed foods. And I'll just quote from the journal Nutrients here. A Western diet has been linked to changes in the gut microbiome and epithelial barrier function and seems to have a direct influence on immune function, triggering a pro-inflammatory environment. So nothing surprising here. One other unsurprising factor that I just want to make sure to touch on briefly is stress. Those who have high stress or have had a very stressful period do have 2 to 3 times increased odds of developing ulcerative colitis. Abnormal sleep is also a risk factor. Again, nothing new here. Pretty much anything could be increased regarding its risk with poor diet, high levels of stress, and poor sleep. It's just to make you aware of how important these things are to tend to so as to keep yourself healthy, or if you do have a condition, to help improve your health. Medications are also a risk factor. Antibiotics, especially when used early in life, and anti-inflammatory painkillers or non-steroidal anti-inflammatory painkillers, NSAIDs, like ibuprofen. So another thing to be aware of. And the final risk factor here I wanted to cover just in brief are disruptions in the community of bacteria in your gut. Dysbiosis, a reduction of the diversity or good bacteria, and also infections are a trigger. We know that post-infectious IBS is a thing, and the same thing seems to account for inflammatory bowel disease, IBD, where a bout of traveler's diarrhea, food poisoning, so throwing up, diarrhea, potentially both, something like salmonella or campylobacter may be the offending domino that tips you into this inflammatory and autoimmune cascade. Now, the good news here is that there's a lot that can be done, and I want to come to that in just one moment. But first, did want to touch on what testing is available to help firm this up. Now, the most definitive diagnosis will be obtained through a colonoscopy with corresponding biopsy. Other testing is available to help start to indicate that colitis could be present. So colonoscopy and biopsy, most definitive. Inflammatory markers like C-reactive protein and ESR, erythrocyte sedimentation rate, and also other markers of inflammation that can be drawn from the stool, calprotectin and lactoferrin, and these do tend to track with severity of colitis. And then There's an antibody test known as p-ANCA, and this has some utility, but it's not definitive. So it can throw up a flag, but in and of itself, it's not diagnostic. And then you may also see, as we touched on earlier, anemias, either low iron, low ferritin, or low vitamin B12. And other tests could be a CT scan, MRI, barium swallow, or an X-ray. I wouldn't overly worry about exactly what tests to do. This is what your healthcare provider should direct you towards. But these are some of the tests in the repertoire to help get you to a diagnosis. And then coming to treatment options, let's first cover the standard conventional medical anti-inflammatory medications, most namely mesalazine, but there's a few others. There's a number of immunosuppressing corticosteroids like prednisone, and there's also biologics, Remicade or Humira. And typically the way this it progresses is to induce remission. Something like prednisone might be used. Can't be used long-term, but can be used to calm things down. And then in a longer-term application, mesalazine might be used. And if someone fails on mesalazine or one of these 5-ASA-type drugs, then a biologic like Remicade or Humira can be offered up. And if things are very severe, then there may be the need to remove part of the colon. Now, thankfully, there's a number of natural treatments that I think you should know about, most namely probiotics being very easy to use and very safe and very readily available therapy. And I just wanted to share with you a meta-analysis from the European Journal of Nutrition looking at 38 randomized control trials studying probiotics in inflammatory bowel disease. And they found with a large effect size, a large impact, that probiotics improved ulcerative colitis severity and also improved levels of bacteria in the stool. In the study, they found that a multi-species blend of various lactobacillus and bifidobacterium species at a dose of anywhere between 10 billion to 1 trillion was best. So the exact formula does not seem to matter. The exact dose does not seem to matter. One caveat here I did want to make sure to mention. You should give yourself 3 to 4 months to see the peak benefit. You'll probably have an indication within a month if a probiotic is helping, but you may not see the peak benefits for 3 to 4 months. Also, there's one nuanced finding from this study that I think is important, which is for inflammatory bowel disease specifically, a combination of probiotics with prebiotics might be the most effective. So that's something just to bear in mind, that you may want to start with a probiotic first, assess tolerance, and then add a prebiotic along with that. The reason why I recommend that sequencing is for some people, prebiotics can flare gas, bloating, and loose bowels. So as to be able to troubleshoot and pinpoint what your system may or may not tolerate, I prefer staggering or sequencing. This wasn't published in that study, but clinically, I've just found that to be the best way to be able to circumvent reactions. Also, we've talked about inflammation. Curcumin is a very well-studied anti-inflammatory spice or herb. And I want to share with you a meta-analysis from the Annals of Gastroenterology looking at and summarizing 7 randomized control trials. They combined that medication, mesalamine from a moment ago, with curcumin or placebo. And they found that curcumin was effective in enhancing the effectiveness of the medication mesalazine. So if your doctor has given you mesalamine, you can combine that with curcumin to have a better anti-inflammatory effect. They used a dose anywhere from 100 milligrams to 10 grams, so a pretty wide dose range, and no optimal dose of curcumin was found in this study, and the duration was used anywhere from 1 to 6 months. So I certainly think curcumin is something that if you have colitis, you may want to consider along with probiotics. Now, we should certainly discuss diet, and this is not an exhaustive list of the dietary options, but a low FODMAP diet, especially if you've noticed vegetables and fiber and fruits seem to aggravate you, a low FODMAP diet might be a very good fit for you. Additionally, there's some pretty good evidence for the Mediterranean diet in improving ulcerative colitis and decreasing inflammation. Now, you could also recommend a paleo diet. There's at least one trial on that. There's at least one trial with the autoimmune paleo diet. I'm sure that for some people, a carnivore diet could be helpful. There's lots of dietary options. My preference is to recommend the most minimally restrictive diet. And hence, I think a starting point of low FODMAP or Mediterranean might get you the most improvement with the least amount of restriction. Also, I want to make sure to mention another, I use the term diet here loosely because an elemental diet is really a medical food or a dietary supplement. But a elemental diet being a complete meal replacement shake has a lot of evidence showing benefit for inflammatory bowel disease, including colitis. If you wanted to do something that would allow you to not eat a normal meal, but essentially have a meal replacement shake that's formulated to be very easy on the gut, there's an impressive amount of clinical trials showing improvements in inflammatory bowel disease with elemental diet. So don't forget about that also. So in close, we've covered what is colitis, what occurs in colitis, the symptoms and risk factors for colitis, and also what you can do. Remember, you have a lot of power because as some of these studies have found, you can combine natural agents along with conventional care and see a nice enhancement of the effects, or even start with the natural agents. Make sure to check this with your healthcare provider before making changes, but a lot of power in your hands for dietary, lifestyle, and supplemental interventions that can improve colitis and reduce the inflammation in your intestinal tract if you have it. Alrighty, this is Dr. Ruscio, and I hope that helps.